Americans eat 152 pounds of sugar a year.
What?
Yeah. Average across just naturally occurring and added sugars. It's gross. When you eat this way, when you are living this way, and when you're stressed all the time, that intestinal permeability is there. Your immune system gets triggered, and then it leads to this chronic inflammation. And that's when we start to get brain fog. We start to get autoimmune diseases.
Gabrielle Bernstein, a role model for spiritual seekers. I'm in the studio right now with not only someone who I go to as one of my best advisors medically, because like I'm a Jewish woman. So like if you're a doctor, I'm like, Dr. Berzin, come to me. But also a really close friend of mine. So I have to say that you play two roles in my life, which is that you're on speed dial if like something, if Ollie has like a mole or something or whatever is going on, or if a cut or something, or if I've got a gut issue, I'm calling you because you're there for me and you're an amazing medical doctor and major entrepreneur with this beautiful business that you've created that we're going to talk about today. Do you not want to be called an entrepreneur?
I'm totally cool with it.
Okay.
Yeah.
Major entrepreneur with this major business that's like a purpose-driven business that I care so much about that we're going to talk about today. But you're also my good friend. And literally the conversation that we're about to have here with Robin Berzin, Dr. Robin Berzin, is the same conversation that we probably had last week at the coffee shop, which is what you want the podcast to be, really.
Yes.
So welcome to Dear Gabby, my love.
Oh my gosh, it's so awesome to be here. It's so funny sitting across from you because first of all, we are wearing the same outfit, which was not planned. And second, because I saw you last Sunday morning,
not in this outfit,
not in this outfit, feeling like running after our children on the rail trail. And so it's nice to continue here.
Yes. And you have 3, I have 1. So I am definitely not running as much as you are.
Gabby witnessed the abject chaos that it is to
I'm quite impressed.
3 kids anywhere.
I'm quite impressed though. I mean, you guys have it down. You do a really good job.
I mean, thank God some of our friends' husbands were there to actually chase
That's true.
some of the children so that I could focus on the little ones.
So Rob, let's talk first about Parsley Health because you are very public. Like a lot of people know who Robin Berzin is. You know, but many people, particularly in New York City and these big cities, know about Parsley Health. It's this amazing practice that you've created to really democratize a lot of the healthcare things that we might get from a functional doctor, but may not be able to afford. And now you've made it so accessible to so many more people. And so I just want to start there. What is the mission? Why did you start this business? And then we're going to go into the doctor questions because Miss Bernstein wants to know.
The mission of Parsley Health is to bring what we call the world's best possible medicine to everyone everywhere. That's our stated company mission. And what we mean by that is this root cause medicine, this functional approach to medicine. And when I was in med school, I went to med school here in New York at Columbia, and then I trained in internal medicine at Mount Sinai Hospital. And in those places, I was learning the best foundations of conventional medicine you can possibly get. I'm so grateful for that training. But what I saw every single day was people who were living themselves sick, ending up in the hospital, ending up on more and more drugs, living with chronic illness. And I could see that the way we'd set up our healthcare system wasn't going to move the needle on that. And yet I knew, and I was really fortunate to learn about functional medicine, which is this idea that we don't just Band-Aid the symptom, we actually figure out the why and we treat that. And we help people optimize their health in addition to treating disease. And to me, that was just like so cool, so obvious.
Mm-hmm.
I could not understand for the life of me why we weren't doing that.
Mm-hmm.
And I was lucky enough to train in functional medicine with some of the best people you know, Mark Hyman, Jeff Morrison, Aviva Ram, all your friends and doctors.
The midwife at my son's birth, Dr. Aviva Ram.
And so I trained here in New York and elsewhere with some of the best people in this field. And I said, well, these practices are amazing and the work they're doing is amazing. They're helping so many people. They're wildly inaccessible. And if you don't have $6,000 to spend day one for an hour with a doctor, why should you need that to get this kind of medicine?
Mm-hmm.
So long way of saying, I started Parsley Health to make functional medicine available to everyone everywhere at an affordable price, covered by insurance, in a way that was just easy to use because health shouldn't be so hard, but we've made it hard.
Robin, you're such an eloquent speaker. Like that was extraordinary. I will tell you this. If I were listening,
I got to put it on for you, Gab.
But if I were listening right now, I'd be like, sign me the fuck up. And it's a lot of this is online too.
Yeah,
you can do this anywhere. Yeah.
We're 50 state online. And
And you take insurance.
And we take insurance. Right now, we take insurance in New York and California with a
Okay.
lot of plans,
Mm-hmm.
and working my little took us off on getting into more health insurance, which is, as I've cried a tear or two to Gab on over the past couple years, that journey has been definitely the hardest thing I've ever done. But I'm really proud because we were the first ever functional medicine that is in network with health plans. We're working with companies like Hilton and Southwest Airlines. We have some really big names on the way. We work with CVS. And even one of the biggest health insurance companies in the country came to us last summer and said, we're recognizing that treating the body holistically, using food as medicine, treating more than one condition in one time instead of just sending you a zillion specialists for every single symptom you have, we're recognizing that that seems like a good idea and people seem to want this. And you all are the only solution that offers this at scale. And I fell out of my chair. I actually laughed out loud when they came to us and I heard this because I still thought it would be years away. But what's really cool is I think it's not years away. I think it's here now. And my hope is that Parsley can be part of a movement to make this much more the standard of care. Because I just don't think you should have to be rich or have special access for your doctor to have training in nutrition and sleep and fitness and supplements and the most advanced diagnostic testing. But today, the fact is, and we both know this, we both know the people who practice this way, you have to kind of find these private practices. They're really expensive. They're all cash.
They're
It's
very
kind of all
expensive.
over the place. And the other thing about the field right now, which it's not a criticism, it's just an observation, is that, we're really the first ones that have taken a data-backed approach to this. Everything we do is evidence-based. All of our protocols have algorithms behind them. We have a team of 30 doctors all working and practicing this way. This morning, I was seeing patients virtually, and I had a question on how to prescribe something around hormone replacement therapy. I was doing something different and I had a question and I just dropped it into our Slack channel for our docs. And I know that I have 35 doctors all trained because we have our own fellowship program that trains our docs.
Oh, cool.
There to answer my question. And then I was like, how cool is this? My patient's not just getting my brain, they're getting 35 brains.
That's right.
And I think that there's a benefit to that too, because, and I did this in the early days, you probably remember when I was practicing on my own. It's hard to be a private practice with just one or two providers. You're sort of on your own. So really proud that we're in network with insurance, that we have this data-backed, evidence-based approach, because ultimately the field to gain traction has to be a network and be an insurance, but it also has to be more credible, candidly.
Yep.
And more standardized. And so that's what we're here to do.
But that's the balance, right? So for someone who's not familiar with functional medicine, define that, because I think it is the balance of between, you're a Columbia trained doctor, and you are also very up on what is the absolute best supplement that you could take to heal your gut. And that combination of the two is, in my opinion, the only way to practice healthcare, in my opinion.
I 100% agree. And I trained at Columbia, Mount Sinai. These are amazing places, but I didn't see anyone who knew about this stuff. And then I went and trained in the Institute for Functional Medicine and with these amazing doctors, as I mentioned, and I learned that way of practicing. One of the reasons we developed our own fellowship at Parsley Health is that we have to be able to train doctors who were like me, coming out of top institutions, great practices, but who needed to learn this stuff and needed to learn it in a standardized way. And so we created that. So
how would you define functional medicine?
So for everyone listening who's like, what on earth is that? It's a totally normal sentiment, by the way. You don't need to know what it is. So the way that I define functional medicine is that we're here to find and treat the root cause. I'll give you a simple example. You and I could both have migraine headaches. Turns out a migraine headache could have a lot of different root causes. One could be a dairy allergy or dairy sensitivity. Some people are sensitive to the proteins in dairy. It triggers a migraine.
Wow.
Another could be an imbalance in the hormones in the menstrual cycle. Another could be a magnesium deficiency. Regular docs don't test magnesium levels. Another could be too much caffeine and stress. And I had one patient whose migraines were caused by the fact that she was drinking 40 ounces of coffee a day. 40.
My God.
For years. Another trigger for migraines could be inflammation and autoimmune disease. Another trigger for migraines could be poorly managed high blood pressure. The list goes on. But guess what a root cause of a migraine is not?
What is it not?
It's not a painkiller deficiency.
Right.
That does not exist medically. And yet, in my training at these amazing hospitals and medical centers, I was trained to kind of manage a migraine in the following way. Okay, here's a painkiller. Okay, if that doesn't work, here's a sumatriptan, which is another type of drug for migraines. All right, now that's not working. Let's go to a neurologist and Botox and a headache center. And now you've taken so much ibuprofen, you have a stomach ulcer and you need an endoscopy from a GI. And the list goes on. And so that's managing a migraine. It's not solving a migraine. And
Yes.
so at Parsley, what we do differently is we do this whole analysis. We call it a root cause medicine analysis when you start with us. We go really deep into your history and we go all the way back to childhood. Because, like, most of these conditions didn't fall out of the sky yesterday. They've been kind of around for a while. And so we go back in time. It could be your childhood or your teenage years, or you maybe had this started 5 years ago. Like, what was happening in your life 5 years ago? The other thing we look at is what you're eating, how you're moving, how you manage stress, what your relationships are like. Do you have meaning and purpose? Your sleep, right? We look at all of this stuff in detail. And then we do diagnostic testing and we do the tests that really look at the body as an ecosystem, right? Like I know we want to talk about gut health today, maybe. Like what's happening in your gut is also happening in your brain. And
Big
so
time.
the functional testing looks at all that. So we do that. That's this big data set. Our docs are all trained in how to interpret that and how to look at that and also how to get to know you as a human being and see what's really going on. And then we use that information and we prescribe holistically. So as opposed to saying just here's a medication. And by the way, we're pro drug. We will prescribe medications. We prescribe drugs every single day. They're very important. But we also will prescribe a nutrition protocol. Like, hey, maybe you're sensitive to dairy. Let's eliminate dairy for 30 days and see.
Yep.
And if we help you figure out that dairy is triggering your migraine and we help you find a dairy alternative, and then your migraines go away, and then the sumatriptan and the painkiller and the Botox and the neurologist and the headache center all go away, that saved you a lot of time, a lot of pain, a lot of money. You got better. We got great outcomes. And we didn't need all of that stuff.
And less of a burden on the overall system.
And which is why, by the way, for anyone who cares about this stuff, the healthcare system's starting to wake up and care.
Right, exactly.
Sadly enough.
Insurance companies are like, hey, Robin, come on board. Exactly. I couldn't agree more. And I think that the way that I was brought up was really extreme in the functional side. And I've actually gone somewhat of the other way. So I think there's two sides, right? But that's why I love what you do at Parsley, because you just said it. You're like, we prescribe medication all day, every day, but we're doing both. And, I was brought up totally homeopathic, I never fulfilled a prescription until I was diagnosed with postpartum depression. I walked into the pharmacy and I was like, how do I do this? I was 36 years old and my husband was with me and I was like, where do I go? And he's like, you go to the counter. I had never, ever.
I'm hearing in Zach's voice.
He's like, get to the fucking counter and get that medication that's going to save your life. And so that was actually my journey in medication, was through postpartum. But and I think that there's two sides to this, right? It's like you can go so down the extreme path of being like, I'm homeopathic and I'm only taking vitamins and supplements and this and that. But then for me, that almost actually took my life because I didn't medicate for postpartum until 4 months later.
Right.
And so I think that that balance that
it's so important.
Have. Exactly.
It's so important. And so few people are like you, coming from that way of not taking medication,
Not a lot of
the more
people,
functional or natural approach. But I always say it's not natural or the highway. We are not going to Reiki your UTI away, people. It's not how it's going to work, right? And so, and why should you have to choose? Like, I ended up firing my first OB when I had my first pregnancy at Cornell, one of the top hospitals here, because I was just so frustrated how much she didn't know. Something simple like she didn't even ask about my genetics, and she told me, oh, just take this, over-the-counter prenatal, something filled with dyes, something that had really inadequate types of nutrients in it, had the wrong type of B vitamins for me, and with my MTHFR genetics,
right,
that would have made me a higher miscarriage risk. Luckily, I know that stuff, so I was already on like my prenatal, but most people don't know those things.
The rest of the world does not.
It doesn't. And is this OB-GYN's fault? Is she not? I mean, she's talented. She's an amazing doctor. It's not her fault, but she wasn't trained in it. And so, unfortunately, a lot of our medical community doesn't have this training, and therefore then they dismiss this medicine, despite the fact that the evidence base is clear, right?
Yeah.
And in our world, just like you said, we're not rejecting medications and surgeries and procedures. We're embracing those things. And in fact, we're doing much more cutting edge diagnostic testing and treatment at Parsley than you're actually usually getting at your regular doctor.
And at Parsley, if you're going to go on an antibiotic, you're also going to say, follow it up with this probiotic and this diet and take sugar out and blah, 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 so that you don't go and create candida, right?
So you don't get a yeast infection.
Correct,
So your gut's
correct.
not messed up. And so you
Correct.
don't end up with sinus infections. And do you want to join the team? It sounds like you know.
I literally could be the best publicist ever for your company.
I mean,
I
you could be a doctor. I mean, at this rate, you're like prescribing.
Well, you know me.
probiotic
I know
regimens.
every damn thing about the gut. Let's get into the gut because I am truly a Dr. Bernstein here is an expert in the gut, but only because I experienced it. And one of the things that you said that was so beautiful is that you start from early childhood, because for me, all of my gut issues stemmed from childhood trauma. And so if you have trauma and you're in a constant state of fight, flight, and you're constantly in hypervigilance, you're going to create inflammation in your gut. And no amount of truly the only real recovery I've had with my gut came from the trauma recovery, which is why I want to just give every single reader, every single person at Parsley like a copy of Happy Days, right? But because that question of like, where were you when is so, what happened when you were a child is so valuable at the onset of this in the why.
It's everything. And even in my medical training, my, conventional medical training, Columbia, they taught us so much. The story, the clinical history holds all the clues. And yet then you get into practice, and we don't practice this way at Parsley. Our visits are 30 or 60 minutes with our patients, but out in the world, it's 15 minutes. Doctors don't have time to go really back all the way. And so if you tell me you're having gut issues, one of my first questions is, well, when did they start? Was it 2 weeks ago, last year, 10 years ago, 30, 40 years ago? What was happening in your life then?
Right.
Because I have to go back to that origin story to understand how we got here. That's usually the path out.
Correct. That's right. So we'll get into actually some medical things that we can do for the gut and some functional approaches to the gut. But just for listeners, if you know you've had experience with trauma, there's a chapter in Happy Days. I'm just going to give people this guidance. And it's all about the psychosomatic effects of physical conditions. And so we could do a whole other episode on that, you and I. And so we'll park that for now, but we'll come to the concept of like gluten, dairy, sugar, stress, what's affecting the gut, and then what is the gut affecting? Brain fog, libido, I mean, everything, right? So dive in here because I'm so passionate about this and I've gone so far down the road of healing the gut and I know all the supplements and many of them help. And I also know the trauma recovery that helps too. But talk to us about the medical side of that.
It all starts with the gut, right? And so like a little quick, super mini biology lesson, because we say the gut. And if you talk to people, as I do, talk to patients, you realize people are like, what is that really? You know what I mean? Like sort of grounding us in what is happening in our gut, right? So your digestion, stem to stern, mouth to bum, right, is this long tube. And it's taking in the outside world, which we don't think about a lot, right? You drink water, you drink drinks, you eat food, you take medications. All of this outside world is coming through you. And then your digestive tract has this insane, amazing, cool structure that allows it to take everything from the outside and turn it into something that can go inside of your body. And it's in doing that, it has to protect you, which is why 70% of our immune system is in our gut. And in doing that, it has to be smart, which is why 95% of our serotonin's in our gut and why we have something called the enteric nervous system, which is like a second brain with 500 million nerves in it, which is so crazy. And your gut is this really smart organism. And at the same time, it's really delicate. The lining of your intestine is 1 cell layer thick.
Really?
1 cell layer thick. And so it's also really delicate and relies on all the bacteria and microbes that are in there to protect it. And so when we're bringing in all these things and we say, well, why are everybody's guts so messed up? Because 40% of Americans have some sort of irritable bowel syndrome, acid reflux, GERD, right? Your irritable bowel disease, which is Crohn's, colitis, autoimmune diseases like celiac. We've really done a number on our guts.
Big time.
Huge, which is why this is so common. And what I see all the time before we get into how we fix it is like people ignoring this. A lot of people just live feeling really uncomfortable in their digestion and they sort of tell themselves like, oh, this is just the way it is. I just have reflux every time I eat. And I always remind people this is not normal. Like you should not live this way or
Right.
feel this way. This is the most important organ because it's taking in the outside world. And so when we think about what's impacting our gut today the most, it's a number of things that are really, really common that we're all doing. It's foods that can be toxic to the gut. So everyone always asks, well, is gluten really that bad or is wheat really that bad? Or I feel fine when I eat it. For some people, it's okay. But the gluten protein is in and of itself, for a lot of people, really destructive to that single cell layer, tiny tissue paper, thin,
Delicate is the word.
delicate lining. And it's like a sort of a bull in a china shop running into it. And so you can get these microscopic holes. All the pesticides and chemicals in our environment make these microscopic holes too. It's what is called, for people who listen to this stuff, it's called intestinal permeability or leaky gut.
Yeah.
Chronic stress, so being in trauma and fight or flight for long periods of time,
Can
and
create gastritis. Yeah, that happened to me.
it immobilizes your gut. So that nervous system, which keeps your gut moving without you having to think about it, when you're in chronic stress and chronic fight or flight, gets paralyzed and things stop moving naturally. And then you get reflux, you get bloating,
SIBO.
you get small intestinal bacterial overgrowth because you don't have that normal motion of your gut. You get constipation. Sugar, high sugar diets. Americans eat 152 pounds of sugar a year.
What?
Yeah, average across just naturally occurring and added sugars. It's gross. And that is destroying the good bugs in our gut that are protecting our gut lining, that are making neurotransmitters like GABA that are important for our calm and our focus, that are keeping that immune system that's in our gut happy so that we don't get chronic inflammation. So you basically, if you're ibuprofen, I'm talking about that a lot today, but those over-the-counter drugs also can really mess with your gut. Alcohol.
Although ibuprofen's like really if you take a lot of it, right? Like,
Well, a lot of people are taking a lot of it.
yeah,
A
it's
lot
not
of
like the
people are
once a
taking
week
it.
you're taking it around your period. You're taking it
Yeah, around
yeah.
your period. People are taking it like every day.
Daily, yeah.
Some of these medications and a lot of other medications. I mean, medications that one of the common asthma drugs has just gotten a black box warning because of its impact on mental health,
Yep.
and what it's doing kind of to that gut brain axis. So there's a lot of medications that we don't even think of as impacting our gut, right? They're for something else. They're for our asthma. They're for our headache.
And sometimes you have to weigh out the risk reward of those medications.
Absolutely.
Yeah. Yeah.
And some of them you're taking them all the time. And it's not that those medications are bad or you shouldn't take them. It's just bringing awareness that those plus the foods, plus the alcohol, plus the stress, plus the pesticides, et cetera, are all, plus just infections that we get, right? Common parasites. All these things kind of come together. If you had a lot of antibiotics, you can kind of mess up your gut microbes.
And then become more susceptible to parasites.
Exactly. And none of this is our fault, by the way. Like none of this is intentional. It's just the way we live our lives today.
It's also, particularly in American culture, just very common.
Yes.
Yeah.
And so when you eat this way, when you are living this way, and when you're stressed all the time, that intestinal permeability is there, your immune system gets triggered, and then it leads to this chronic inflammation. And that's when we start to get brain fog. We start to get autoimmune diseases, rheumatoid arthritis, psoriasis, eczema. Celiac disease for some people really shows up with anger and irritability and skin rashes and joint pain and brain fog without any digestive symptoms.
Wait, talk to me, because right now I have brain fog. Well, I've always had a lot of brain fog, which is all gut related. Yes. Even if I have a slice of pizza, let's just say I'm like, oh, I'm going to just have like a cheat day. I literally can't remember anything the next day. Or that night. I literally can't like say words.
I feel the exact same way though.
Yeah.
If I have a slice of pizza, for me, I'm gluten sensitive in that way. I'll get little breakouts, like I'll get eczema on my scalp, and I get brain fog and I get irritability. And a lot of people are eating this way and they don't even realize that it's the foods.
Yep.
And so much is in our gut. But the cool bit is that you can actually heal all this stuff really beautifully. And by eating real whole foods, by cutting out the sugar, for some people, cutting out the gluten for at least 4 or 6 weeks, just experimenting, like starting to see what you feel like without some of these things, being mindful about your consumption of things like ibuprofen, right? Am I taking it every day? That might be a little too much, right? Drinking plenty of water, taking a good probiotic. You can start to shift these things and start to get your digestion back on track. And then meditation, spirituality, stress reduction, using the Gabby coaching app to stay on track with that. That will help your gut start to move in the right ways and start to take care of itself better.
Yeah. And I think that we can also, they have to go together. You could do all the spiritual work, but then eat like crap and still have gut issues. You could do all the holistic things and eat perfectly and have the most beautiful alkaline diet, but be living with undiagnosed and unaddressed, not addressed major PTSD symptoms, and do everything perfectly and pristine in your stomach, like I did for many years, and still have major gastro issues if you're not addressing the root cause in that case, which is also the psychosomatic condition.
Yes.
Questionnaire. I mean,
Yeah.
I was part of this Parsley Health Collective like a decade, like for so long now. But what is the onboarding process?
Yeah. So it's super simple. You can just join now and sign up online. You can schedule your visit with your doc right away. Create an account and schedule a visit with us. If you have questions and you're not sure, we offer a free 15-minute consult call
Whoa.
with one of our membership advisors.
Wow.
Who are awesome, by the way. The woman who leads that team on our team is just my hero. She's so amazing. And they will talk you through, is this for you? How does it work? How does it work with my insurance? So yeah, about 50% of our members do a call and sign up. So that's free. Sign up for one of those, learn more. We also have something really cool right on the homepage of the website, which is your symptom score. And you can do that. And it covers 9 aspects of your body. It covers your hormones and your heart health and your mental health, like how you're feeling. And it's such a good check-in. You could do it every day if you want, and you'll give you a score. But a lot of us are just not feeling what's happening in our bodies,
Right.
or we're unintentionally ignoring it because we don't want to deal. And that symptom score can just be like a little number. Oh, how am I feeling? And if your symptom score is really high, we give you a little readout of it and we tell you, well, this is pretty high. And if you have symptoms that are really high, it means that there are things happening in more than one part of your body. So if you've got hormones that are amiss and heart health, or if you've got mental health and skin and bones and joints, that might be an indication that you have an underlying condition. And only 10% of Americans get preventive testing. We wait till the wheels are falling off the wagons to get testing, and then sometimes it's too late, right? So just even doing that symptom score can give you like a little bit of a sense of self-reflection. And then, okay, what do I want to do with that? Do I want to take this score to my primary care doctor or my functional doctor? Do I want to work with Parsley? What do I want to do with this information? But hopefully it gets people sort of into their bodies a little bit.
So smart. Parsleyhealth.com. I think a lot of people listening are going to be running over there now because it's a beautiful way to heal.
Thank you.
Thank you. I love you.
Love you.
If you like this video and you want to get more Gabby, check out the next one right over here.